AP 120, Chapter 19. Topics: accessory structures, penis, and hormones. So, again, the male reproductive system includes the ductus deferens that carries the sperm to posterior of the urinary bladder, and then the ejaculatory duct, which sends the sperm into the urethra. And as you can see clearly, the urethra and the ejaculatory duct are found in the prostate gland, which is directly inferior to the urinary bladder. And of course, the ejaculatory duct is used during ejaculation. Now, the seminal vesicles attach to the ejaculatory duct, so that when sperm leave the ductus deferens and enter the ejaculatory duct, fluid from the seminal vesicles also enter the ejaculatory duct. The seminal vesicles secrete an alkaline or basic fluid that also includes fructose, an energy source for the sperm for their mitochondria, and hormone prostaglandins, which causes muscular contractions in the female reproductive tract. Then, of course, we now have the fluid from the seminal vesicle and the sperm in the prostate gland, and the prostate gland, a chestnut-shaped structure, will then secrete its fluid, which is a thin, milky, slightly acidic fluid. It includes the nutrient citrate, which again will be used as a nutrient for the sperm for the production of ATP, and also the prostate-specific antigen. This is an enzyme that helps to liquefy the semen to make ejaculation more effective. Prostate gland problems. Well, there's prostate cancer. So one leading cause of death from cancer in men is prostatic cancer, where the cancer develops in the prostate gland and in the process also causes the prostate gland to grow in size. And a relative easy way to test for this is through the digital rectal exam, where the doctor inserts their index finger through the rectum and palpates the prostate gland through the wall of the rectum, giving them an idea of the size of the prostate gland. All right, we also have the bulbourethral glands, two of those. They are inferior to the prostate gland and they secrete mucus. This mucus is important to lubricate the urethra to aid in the ejaculation process, and also the mucus is a component of the semen itself. Semen has something like 120 million sperm per milliliter, as well as the secretions from the seminal vesicles, the prostate gland, and the bulbourethral gland. Sperm cells cannot fertilize an egg until they undergo what's called capacitation. This is a weakening of the membrane over the chromosome. The chromosomal membrane then will help allow the enzymes in the chromosome to penetrate the egg, the oocyte, should the sperm make it to the egg cell. And of course, the fertilization and the capacitation occur in the female reproductive tract. No need to do it ahead of time. Also worth noting that something like 96% of the sperm produced are morphologically abnormal. So almost all the sperm that are produced don't actually have a proper structure. All right, moving on to the penis. It is a cylindrical organ made up of three specialized erectile tissues. You have the corpus spongiosum. Corpus spongiosum is a erectile tissue that surrounds the urethra, and its job is to keep the urethra open during an erection. That way you'll have a smooth ejaculation. Also, the corpus spongiosum is the primary tissue of the glans or head of the penis. And then there are two cylindrical erectile tissue structures called the corpora cavernosa. And the corpora cavernosa, these tissues fill with blood. They have caverns that will fill with blood. The increased in blood pressure and the hydrostatic pressure within the corpora cavernosa is then what will cause the penis to become erect. And again, the penis is designed to both convey urine to outside the body as well as to convey semen outside of the body. So it has two purposes for both the urinary system and the reproductive system. The glans penis is again the distal end of the penis, and it is covered by what's called the prepuce, also known as the foreskin. So male infants are born with a prepuce in place. Many infants or even some adult males will have circumcision. Circumcision is the surgical removal of the prepuce that covers the tip of the penis. The American Medical Association and American Pediatric Association are both neutral on circumcision. The possibilities of complication of circumcision is about the same as the complications caused by not being circumcised. So they don't take a stance on it. All right, erections. Again, erections are caused by an increase in blood flow within the corpora cavernosa tissue of the penis. This is usually caused by sexual arousal, and the neurotransmitter is nitric oxide, a gas, and that will cause increased blood flow by dilating the arteries within the corpora cavernosa. You also have the veins near the surface of the penis, so that as the tissues expand, the veins will get compressed, so you have much more blood entering the penis than leaving, leading to the swelling in the size of the penis. All right, some other disorders in male reproductive system includes cryptocytism, which is when the testes do not descend into the scrotum before the infant is born. Usually they wait a little bit to see if it'll happen on its own, but if it doesn't, then surgery is performed to place the testes in the scrotum. There's priapism. Priapism is a persistent and usually painful erection that can last for several hours, can lead to damage to the penile tissues. And then there's, of course, acute and chronic prostatitis. Prostatitis, inflammation of the prostate, can cause the prostate to expand in size. This can lead to a pinching of the urethra, so obstruction of urine flow. It also can push on the urinary bladder, causing the urge for increased urination, and is often also painful. So this is a separate cause of swelling of the prostate gland. Male reproductive development starts off in the hypothalamus. This starts the puberty process. And by signaling the release of gonadotropin-releasing hormones from the hypothalamus, that will go to the anterior pituitary gland. And then the anterior pituitary gland will release the hormones luteinizing hormone and follicle-stimulating hormone. These will then enter the bloodstream. The luteinizing hormone will go to the testes and promote development of the interstitial cells. The interstitial cells will then secrete testosterone, which will go into the bloodstream. And the follicle-stimulating hormone will also arrive in the testes and stimulate the sustentacular cells so that they will respond to testosterone. And when they are exposed to testosterone, this will lead to spermatogenesis. So the combination of testosterone and follicle-stimulating hormone causes spermatogenesis, the production of sperm in the male. The sustentacular cells will also secrete the hormone inhibin, which will go into the bloodstream and go to the pituitary gland and hypothalamus to let them know that they no longer need any excess follicle-stimulating hormone because they are indeed producing sperm now. And testosterone is an androgen, a very important hormone that leads to the development of the male reproductive structures. First time the male is exposed to testosterone is as an embryo, causing the embryonic reproductive tissues common to both male and female embryos to develop in a male pathway. Then testosterone is also, of course, produced during puberty, which will then have many responses in the male's body, increasing the rate of cellular metabolism, increasing red blood cell production, increasing body hair production, growth in the penis, deepening of the voice, many possible things. So again, we had gonadotropin-releasing hormone going to the anterior pituitary gland, causing it to produce follicle-stimulating hormone and luteinizing hormone. They go into the bloodstream, reach the testes, stimulate the interstitial cells to produce testosterone. Testosterone goes into the bloodstream, goes all throughout the male's body, increases muscular growth, thickening of bones, strengthening of bones, thickening of skin, enlarging reproductive organs, enlarging the larynx and vocal folds to deepen the voice, and increased growth of body hair. And then, of course, the hypothalamus and anterior pituitary gland will detect this testosterone to try to prevent oversecretion of it. Micropenis is when a male is born and goes through puberty and ends up with an unusually small penis. Usually the dorsal measurement, the measurement on the top of the erect penis, is smaller than 7 centimeters, which is significantly smaller than the average adult size of 12.5 centimeters. All the other structures are appropriate size, and all the structures are not ambiguous. So it's clearly a male reproductive system, just with a slightly smaller penis. That is it for the male reproductive system.